While the U.S. struggles to contain the coronavirus outbreak, there is promising news on the horizon. So far, more than 11.7 million Americans have tested positive for COVID-19 since the start of the pandemic. However, earlier on CBS This Morning, Health and Human Services Secretary Alex Azar discussed the potential release of a coronavirus vaccine in the near future.
Hope and help are on the way. Pfizer filing today for emergency use authorization means that FDA will very quickly announce that we'll be scheduling a public advisory committee process of independent experts who will give FDA their best views on the data. And if the data is as solid as it appears, and if the company is transparent in their interactions, we literally could be weeks away from the authorization of a 95% effective vaccine. And we've said 24 hours later, we'll ship millions of doses of that vaccine, and within a couple of months, between Pfizer and Moderna's vaccine, assuming they both are approved, we will have vaccinated tens of millions of America's most vulnerable citizens.
Dr. John Moore is a professor of microbiology and immunology at Weill Cornell Medical Center. And he joins me now. Dr. Moore, welcome. Great to have you with us. You know, as we've heard, Pfizer is applying today for emergency authorization of its vaccine after testing revealed it was 95% effective at preventing coronavirus infection. Secretary Azar says it will take several weeks for approval and will be ready to ship 24 hours after that. What more can you tell us about this process and how soon the American people can really expect distribution to begin?
Well, thanks for having me on the show, Tanya. I look forward to talking to you about this. Yes, weeks away. The FDA will take a couple of weeks to review a large body of information that's been submitted to it. And there are key committees of independent experts that are due to meet probably around December the 8th to 10th, so, you know, a few weeks away. And they will review the information they've been given. They're independent experts. They're people that my community has a great deal of trust in, people of high integrity and high skill. And they'll take a couple of days to do their work and submit a recommendation to the FDA within days, so approximately the middle of December. And if those recommendations are positive, the FDA would grant an approval sometime in mid-December. And as Secretary Azar said, the vaccines that are being reviewed at that meeting could then be distributed within days. So we're talking about the middle of December if all goes well, if the advisory committees are persuaded that the data are appropriate.
And of course, we have 3 potential coronavirus vaccines that are all reporting 90% or higher effectiveness. How promising are these latest breakthroughs? Is this just an embarrassment of riches?
Well, it's way better than we expected. We were all talking among ourselves, as one does, and speculating that perhaps we would see 65%, maybe 75% if we were lucky. But 95% exceeded our hopes and is a really outstanding result. So we were very pleased to see this happen. We will need multiple vaccines. As you say, there are 3 that are now meeting that level. There are others that are in trials and will report their data by the end of the year, perhaps, or in early 2021. And we will need all of those vaccines because we need the numbers of doses if we can immunize the majority of the population successfully.
And of course, Doctor, the CDC is now urging people to avoid travel and stay home this Thanksgiving in an effort to further prevent the spread of COVID-19. For those who decide to continue with their travel plans, how do you suggest staying safe during the holidays? What precautionary measures should they take? And realistically, should the country be prepared for a post-holiday bump in coronavirus infections?
Yes, unfortunately, it's going to be a horrible winter. The death rates and infection rates are skyrocketing. People are still not behaving in a sensible and appropriate manner that we hope and we've been encouraging all year. Wearing masks, socially distancing, these are the weapons that we have available now, and we need to be using them as much as possible. And yes, we need to be sensible over Thanksgiving. My family is organizing things this way. My son and his girlfriend are visiting us over this weekend, and my daughter and her fiancé will visit us over Thanksgiving, and we'll avoid a large group. And my wife will, as always, prepare a super spread, but we certainly don't want to have a super spreading event around our house. So I run risks on a daily basis by coming to a medical school. I need to protect the kids from me, not the other way around. So everyone needs to assess what their comfort zone is and act responsibly, because we're going to have a lot more Thanksgivings in our lives if we're still here to enjoy them next year and in subsequent years. But let's not be stupid this Thanksgiving. Let's just reduce risk to the extent that we can and make a short-term sacrifice for long-term gain.
So sensible, Doctor. Yesterday, President-elect Joe Biden spoke with a group of 10 state governors from both sides of the aisle about a plan to tackle the pandemic. During a press briefing, he had this to say about the issues his administration will face in distributing a COVID-19 vaccine. Let's listen.
The second thing there was uniform agreement on, delivering a safe and equitable and free vaccine. The governors all acknowledge that this will be a massive undertaking, one of the greatest operational challenges we will have faced as a nation. One statistic that was raised by the governors: it took 8 months to provide 100 million COVID tests. 8 months to provide COVID tests. Just imagine how much more difficult it will be, they pointed out, if we don't find a more efficient and effective way to provide 330 million vaccinations.
The Trump administration has denied that the Biden transition team the team access to all information surrounding the coronavirus pandemic. So, Doctor, how difficult a task will it be to distribute the vaccine once it is approved for mass production if the transition team has to play catch up?
Well, it's simply shocking what's going on. But the Trump administration is playing with people's lives for politics at this point, and it's just appalling. But there will be a vaccine rollout. There are plans that are being made. There are plans that the Biden administration will inherit at some point. It'd be best if they were planning it now together, but this unfortunately is just not happening. No one pretends that this is going to be easy. Distributing 2 doses of vaccine for every person, and there are hundreds of millions of people that will want them, is going to take months. This is not going to happen overnight. We're talking about rollouts ramping up in the spring and summer, so that perhaps by the summer of 2021, enough people will have been vaccinated that we can make a real difference. And there's going to be prioritizations. High-risk groups of people will be prioritized. Healthcare workers, first responders, people at particular risk. There's going to have to be a major effort made to increase trust in minority communities which have traditionally resisted full access to healthcare because of historical inequities and distrust. There's going to be major efforts that must be made in those communities so that as many people as possible in the highest risk groups are vaccinated first, and people in lower risk groups will simply just have to take their turn and wait for a few extra months. And that's how it should be. And not everyone can be vaccinated overnight, but it is an achievable task, and it's accomplished.
Doctor, you make a very good point that the low-risk communities are the ones that should be vaccinated first. However, we've seen the way things work in this country that, the communities with the most resources and prestige, so to speak, often are able to get their hands on these things sooner. And you're saying that we need to have a reverse of that this time around.
Yeah, the vaccines need to go where they're most needed. The people at greatest risk of infection and disease, the people who most need protection. I mean, it's a no-brainer that healthcare workers caring for sick people in a high-risk environment are in the top tier of people to be immunized. Then other people who are coming into contact, I mean, people looking at in homes looking after the elderly will be high priority. And there are plans that are being put together. They've been assembled for multiple months, and the Biden administration team is well onto this. So I still think there are details that will have to be hammered out, but I've no doubt that a fair and appropriate distribution will take place. And of course, there are going to be people who will find a way to jump the queue. There always are in America and all Western countries. But to the extent that it is possible, I believe that there will be a fair and appropriate procedure followed.
Right. Let's hope so. Well, Dr. John Moore, thank you so much for joining us. We really appreciate your time.
Thanks for having me. I've enjoyed it.